Hi, this is Hannah Kincaid and I will be demonstrating administering an IV piggyback with an IV that is incompatible. I will perform hand hygiene and walk into the patient's room and introduce myself. My name is Hannah Kincaid and I will be your student nurse from IVPB. Can I have your name and date of birth?
Yes. Ruth Peer, 12/20/62.
And do you have any allergies?
No.
Okay, I'm just going to assess your IV and your IV site. 0.9% sodium chloride running at 125 mL per hour with phenytoin 100 milligrams added to the solution. I will inspect the tubing for any kinks or air bubbles that may be there. And assess the IV site for any redness, drainage, infiltration, or tenderness upon palpation. Alright, I will be back when I have all my supplies. I will wash my hands, go to the med room, and get my patient chart to compare to the MAR. Ordered is famotidine 20 milligrams IV piggyback. Running is 0.9% sodium chloride with phenytoin 100 milligrams at 125 mL per hour. Going to the Pyxis, I will remove my famotidine and scan it as the first med check. The second med check will be against the MAR manually. And looking at famotidine in the IV drug book, 20 milligrams is the usual dose for this patient. Dilution. Each 20 milligrams may be diluted in 100 mL of a compatible IV solution. We are going to use 0.9% sodium chloride. Compatibility. Phenytoin is not compatible to famotidine as it is underlined under the compatibility in the IV drug book. For the rate of administration, each 20 milligram dose can be given over 15 to 30 minutes, and we will give over 30 minutes to ensure safety. I will gather my supplies. I will go into the patient's room. Perform hand hygiene and reintroduce myself to the patient. Hi, I'm Hannah. I was just in here doing your IV assessment, and if you could just give me your name and date of birth one more time.
Yes. Ruth Peer, 12/20/62.
And do you have any allergies?
No.
I will just scan your name band at this time. And this is where the third check of the famotidine will take place to ensure injection of the correct medication into the IV bag. Since there is 20 milligrams per ml of this famotidine, we will draw up 1 ml for 20 milligrams to be injected into the IV bag. And after this medication is injected into the bag, a label will need to be placed on it in order to have it known that there's a medication added to this bag. At this time, I will take the IV tubing of the primary IV and make sure the roller clamp is turned off and turn off the infusion pump and turn it on for the flush bag at 30 mL with the volume to be infused at 30 mL per hour. I will don gloves in order to do a flush. I will pinch this and inject 2 mL while looking at the IV site, pull back for aspiration of blood, and then push in the last remaining 8 mL of the medication. alcohol again, and we can connect our flush bag tubing to this lower port. And we will turn on the 30 mLs per hour. At this time, we'll remove the blue cap from the IV piggyback, spike the bag while maintaining sterility. Alcohol the upper port on this tubing of the flush bag. And we will back prime until half the chamber is full with liquid. All right. We will lower the flush bag. Hang the antibiotic and set the infusion rate of the antibiotic to 200 mLs per hour. At this time, remove your gloves, perform hand hygiene, and let the infusion run. We will let this run for a half an hour, as the 200 mLs per hour will last about a half an hour with 100 mLs of fluid. After the infusion of the antibiotic, we will remove the antibiotic and we will let 30 mLs of the flush bag run through. After this, we will have to disconnect the flush bag tubing. And we will reestablish our primary IV to 125 mLs per hour. And that concludes the skill. Oh, and I will document everything that we did today.